This is my audience. My name is Jasmine Jefferson, and I'm doing my presentation on Alice in Wonderland syndrome. I will inform my audience about the Alice in Wonderland syndrome and how it came about. Alice in Wonderland syndrome is a perceptual disorder characterized by distortions of visual perception, the body schema, and the experience of time. If I had a world of my own, everything would be nonsense. Nothing would be what it is, because everything would be what it isn't. And contrary-wise, what is, it wouldn't be. And what it wouldn't be, it would. You see. Many aspects of Lewis Carroll's life experience influence his writing. Some of these aspects included his mathematical background and logical disposition, interest in and photography of little girls, abnormal eating habits, dual personality, sleeping difficulties, Victorian lifestyle, and neglected childhood. These characteristics of his life were reflected in his literature, including his most well-known novel, Alice in Wonderland. Alice in Wonderland symptoms have both diagnostic and therapeutic consequences that differ subsequently from those in schizophrenia, spectrum disorder, and other hallucinatory symptoms. According to medicalbag.com, Todd syndrome, most frequently referred to as Alice in Wonderland syndrome, is a disorientated neurological condition that primarily targets children. Alice in Wonderland affects human visual perception of shapes of inanimates and objects that appear to be smaller or larger than normal. Dr. John Todd, a British psychiatrist, first described Alice in Wonderland in 1955. Todd gave its name by the famous novel by Lewis Carroll. Alice Adventure in Wonderland, as the illness resembles the events experienced by Alice. Considering in one recent analysis of 81 people who experienced this syndrome, 17 had reported the duration of their episodes. 9 of these participants had episodes lasting less than 5 minutes. 7 experienced episodes more than 5 minutes. However, one person in this group had an episode last 2 days. Alice in Wonderland can affect individuals of all ages, and as many as 1/3 of sufferers continue to experience ongoing experiences. Episodes of Alice in Wonderland aren't hallucinations. Although the experience is quite vivid, the individual recognizes that what they see or what they feel is not real. Episodes can occur during a headache or migraine, and some consider the visual disturbance to an aurora that comes before a migraine. Those who experience Alice in Wonderland syndrome often have family members who suffer from migraines, may also develop migraines later in life. Triggers from an episode in Alice in Wonderland syndrome include, but aren't limited to, migraine, stress, brain tumors, Epstein-Barr virus infection, drugs, particularly cough medicine, epilepsy, and infection. According to Dr. Sheena Aroa, a Stanford neurologist and migraine specialist, was the first to perform an MRI scan of the brain of a 12-year-old patient in the middle of an episode. Her report concludes that electrical activity caused abnormal blood flow in the parts of the brain that control vision and process texture, shape, and size. To conclude, now that you've got the basis on this rare condition, keep in mind that this rare neurological diagnosis can be confused with a drug intoxication or psychosis. There are no proven treatment methods for Alice in Wonderland syndrome. However, rest and dietary changes are indicated. Most causes of Alice in Wonderland syndrome are self-terminating and resolved by adulthood. One of the deep secrets of life is that all that is really worth doing is what we do for others. Lewis Carroll. So, Alice in Wonderland syndrome is a syndrome of distorted space, time, and body image. It was first described in 1955 by John Todd. Lewis Carroll is the main main person of the Alice in Wonderland syndrome who had Lilliputian hallucination. Alice in Wonderland syndrome is a rare condition of temporary episodes of distorted perception of body size. Episodes can happen in children and young adults, eventually stop occurring over time. Some consider the visual disturbances to be auroras that come before a migraine or a rare migraine environment. It's a rare condition of temporary episodes. You can feel that their body is either larger or smaller than normal. Things can appear bigger or smaller, most often in children and young adults. A few facts: it's a disorientative neurological condition that targets children, affects human visual perception, impaired sense passage of time or feeling of zooming, predominantly short in duration. Their bodies have been altered in size and have visual hallucinations.